So I'm Cape Breton's only plastic and reconstructive surgeon. I did my training at Dalhousie University, my undergrad, my medical school, and my residency. I also did an aesthetic surgery fellowship in Toronto. I have the academic rank of an assistant professor, and I am board certified. And board certified in plastic surgery, like in Canada, is actually really quite strict. You have to do your residency, it has to be accredited programs, you pass multiple exams, you do all of this, and only when you pass all of them, you get to call yourself a plastic surgeon. In the United States, once you pass medical school, you're either board eligible or board certified. You actually don't have to pass your exams to be a plastic surgeon. In Canada, we're not allowed to be. When you say, you have to look at the person who is doing the training for you. There are lots of stuff you can do them for the weekend, for a couple of hours, and they give you a certificate. That doesn't make you an expert in anything. You have to go to lots of meetings. I went to almost 200 meetings in the last 20 years. I visited many surgeons, visited many clinics, always bring your things back. And the idea is that you deliver better care home. That's the idea. You don't have to go far away to get the care. So what's the idea behind all of this? You want to look as good as you feel. You want to live a healthy lifestyle. But there's no replacement for diet and exercise. There's absolutely none of that stuff. You have to live healthy. Some of us are really blessed with good genes. Lots of us are not. You have to work out. We can modify our genetic risk. We cannot change it. One of the things I spend most of my time dealing with is sun damage. If you take anything from this presentation, avoid sun damage. Then you do yourself a great favor. Your skin will be healthier, looks younger, you avoid all the skin cancers you're going to develop later. It's really crucial. So skin care and hydration is absolutely crucial. Stress in your life can be good, but too much of it can be really bad. And whatever you do, if you go to the gym and you have a certain goal, and you achieve that goal, once you achieve it, you have to maintain it. You can't say, I stop. So the same thing with this, a healthy lifestyle at work. You want to look better, you want to get whatever treatment, it's an ongoing maintenance. And if you don't think healthy lifestyle makes a difference, I don't have to say anything anymore. Bad things happen. This guy's going to live to be 1,000 years, but it's amazing. Like people, they do everything right, and they don't do well. Other people do everything wrong. But healthy lifestyle, it doesn't matter how young you are, it really makes a huge, huge difference. So the question asks, what do I need to have surgery? And there's only two criteria, honestly. And it's, if you have them, it's fine. If you don't have them, well, you don't have them. So this is the most important thing for surgery. And if you have that, get whatever you want. And lots of people will give you whatever the hell you want. The same surgeon who gave Michael Jackson his fifth nose. People will do anything. But your job is to remember why you got this in the first place. I'm a physician before anything else. We took an oath. And it's a nice ceremony, it tells you. But actually do no harm is really the crucial. My job is to say no. Is not to indulge this person. This is not my job. I didn't spend all these years training to make someone look like a freak of nature. I spent most of my time, truly and honestly, making you look like before you had your cancer. Just make you look normal. And we forget how valuable normal is. And to look abnormal is really quite a problem. Just the Oscars are coming. Just look at the Hollywood actresses. I don't know what creatures we're creating. They're not going to be normal. And that's not the standard of beauty. Just because something can be done, it doesn't mean it should be done. In medical school, they taught us that. I said, I can have heart surgery tomorrow. I was 30-something. I can, but why do I need it? It's because it can be done. And one of my great teachers, God bless his soul, he told me a valuable lesson when I go by Abdul. He said, Abdul, you know what's the difference between a good surgeon and a bad surgeon? I said, I don't know, Dr. Keynes. He said, Abdul, what happens before they come to the OR? Technically, we're all good. Some are exceptional, but none of us are really bad. But whom you take to the OR, that's the difference between good surgeon and bad surgeon. How do you look after them? What happens in the OR is a technical execution. When I do my breast reductions, the most important part for me is when I do my drawings. The rest is just steps. You do it from one step to the other. So you're having good judgment, good ethic, good principles, you're going to do well. If you forget all of that, then you get this. Lots of people will give you this. If that's what you want, they can give you lots of names. So if you're a good candidate, you have to remember this elective surgery, and people have to remember this. There's a difference between your appendix has to be done tonight. You could get really, really sick. Well, I want my facelift. Well, it can be done today. It can be done a year from now. You need to get yourself in optimal health. You have to know what you're trying to get out of it. You have to have a stable weight. And we both have to see the same thing. So smoking, I'm militant about that. Not good. It really inhibits it. Smoking comes in variety. I know some things became legal right now, and the nicotine and all that. All the healing depends on the tiny blood vessels, and that delays, blocks the tiny blood, but things don't heal and can have major problems. If you really want this, we both have to agree on it. I want this, you have to work for it. You can't just have it if you're a smoker. And if you do a smoker, like you do a facelift in a smoker, you can't pull them as tight. Well, what's the point then? He's going to give you a scar? I mean, there's no point in that. You can't be in bad heart condition, uncontrolled blood pressure, bad diabetes. You have to be healthy for that. You can't have bleeding problems. Stressful times, probably not a good idea. Going through a divorce is not the time to have a facelift. Afterwards, that's fine, but not during. And the last one, the herbal supplements. This is just the medical side of me. People right now say, take any medication. Nope, take any supplements. And they list 20 things for me. People don't think of supplements as medications. A lot of them have aspirin-like effects. So general advice for any of you, your families, if you're going to have any surgery, stop all your supplements 2 weeks before. It just avoids a lot of headache and a lot of hassle. You're going to pay for something, there's cards, you pay for them. You can take bank loans, credit cards, family, alimony payments, whatever you want. You look at the cost of it and consider the true cost. I mean, it's probably less a big deal for injectables, but for surgery, I'm going to have my tummy tuck. It's going to cost X amount of dollars. Well, you know it's going to cost more than that because you're going to have to travel. You may need hotels, time off work, cost of medication, cost of dressing. Do you need any touch-ups? So you need to look at the overall cost and decide about things. Used to be tax deductible. We took that away from us.